June 30, 2020, the WHO declared a public health emergency of international concern. Now we are facing a pandemic, and the virus is called COVID-19. Hi, this is Nurse Jane, and if you are new in this channel, please don't forget to like, share, and subscribe. Coronaviruses is a large group of viruses composed of core genetic material surrounded by an envelope with spikes protein. Different types of coronaviruses causes illness to animals and humans. In humans, it causes respiratory infection. It will range from a common cold to severe disease. In 2003, there was a coronavirus detected in China named SARS-CoV that came from civet cat. Another coronavirus was detected in Saudi Arabia in the year 2012. It's called the MERS-CoV that has been detected that came from camels. And in the year 2019, another coronavirus that shook the world and causing a pandemic, and we call it SARS-CoV-2 or COVID-19, that came from China and is believed that it came from a reservoir of bats. The virus circulates in the range of animals, but there are spillovers that these viruses will transfer to humans due to genetic mutations and constant contact with animals. The transmission of COVID-19 could be person to person through droplets, by coughing, sneezing, talking from an infected person. The virus can also land to different objects, and if you touch it and touch your eyes, your nose, your mouth, you could be infected with coronavirus. Now, the incubation period. The incubation period is from exposure to the development of symptoms that can average to 5 to 6 days and can range from 1 to 14 days. Now, what are the symptoms? A range of symptoms could be mild, moderate, to severe, to critical. But some who have good immune system could be asymptomatic. What are the common symptoms of COVID-19? We have fever, fatigue, respiratory infection that includes coughing, sore throat, and shortness of breath. Some will also develop skin rash, conjunctivitis, loss of sense of smell, loss of sense of taste, and even diarrhea. But for severe condition or severe cases, the patient would develop pneumonia, organ failure, and the worst, death. So there are people who are at risk of this coronavirus. Who are they? They are the older people or the senior citizen. Another is people with comorbidities. The transmission of COVID-19 could be person to person through droplets, by coughing, sneezing, talking from an infected person. The virus can also land in different objects, and if you touch it and touch your eyes, nose, and mouth, you could be infected with coronavirus. Now, we will go to the incubation period. It's from the exposure to the development of symptoms, an average of 5 to 6 days. It could range to 1 to 14 days. So, what are the symptoms? The symptoms can also range from mild, moderate, to severe, to even critical. But some with good immune system could be asymptomatic. But some still will undergo and will experience severe to critical. Now, what are the symptoms or the common symptoms of COVID-19? There will be fever, fatigue, respiratory infection that includes coughing, sore throat, shortness of breath. There are also people who experience skin rash, conjunctivitis, loss of sense of taste, loss of sense of smell, and even diarrhea. But in some cases, like severe cases, the patient will experience pneumonia, organ failure, or even death. So there are people who are at risk, the older people and those people with comorbidities. So it can be detected through RT-PCR. Let's talk about COVID-19 variants. During replication, a virus often undergoes genetic changes that may result to variants. Some mutations may weaken the virus, but some enables it to proliferate. But now we have variants of concern due to their higher rate of transmission. First, we have the Alpha, the B117 found in UK. Another is Beta, the B1351 found in South Africa. We have also Gamma, the P1 found in Brazil and also found in Japan. And we have also variant of concern. It's called Delta, or B1617.2 found in India. Why this is a variant of concern? Because of its fast spreading variant that causes dramatic wave of COVID-19 in India that overwhelms their hospitals, even causes a shortage of oxygen. It's around 55 to 60% more transmissible than Alpha, and it doubles the infections from the original strain. So, evidence found that this Delta variant had the propensity to evade the antibody-based treatment and can also cause a reinfection for patients who recovered from COVID. If you like this video, don't forget to like, share, and subscribe. And if you want me to discuss another topics about health, just comment down below. And see you on my next video. Thank you. Bye.